Welcome to this week's Al-Ghaf Dynamics HealthConnect Middle East podcast episode. As always, we will continue to bring you the latest real-world information and insights on healthcare, life sciences, and wellness in the Middle East region. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to the 8th of May 2025. As always, our information is drawn from regional health ministries, institutions, advanced data, and news outlets coupled with our internal data gathering platform, HealthConnect Middle East. This week's regional health news was shaped by proactive government initiatives, emerging life science programs, and urgent public health challenges. Authorities in several countries launched new campaigns and policies to bolster healthcare quality and innovation, even as conflicts and lifestyle issues continued to strain health systems. Key themes include government support for biotechnology and preventive care, renewed focus on infection control, and the ongoing humanitarian health crisis in Gaza. Healthcare policy and government initiatives. In Iraq, the Ministry of Health announced on May 7 a nationwide ban on all e-cigarette imports, sales, and use, as part of a new anti-tobacco law. Health officials cited a disturbing increase in vaping among youth and warned of the device's health risks. This legislative move is the centerpiece of a broader national tobacco crackdown, with penalties and confiscations planned to deter a generation of new users. Life sciences and research innovation. On May 5, Saudi Arabia's Ministry of Health unveiled a biotech accelerator program to nurture the country's life science startups. The 7-month program offers mentoring, workshops, and investor connections to help Saudi biotech and medical technology innovators ready their projects for commercial markets. This initiative, aligned with Saudi Vision 2030 and the National Biotechnology Strategy, aims to attract investment and integrate local research into global health markets. Applications close May 8, with participants to be selected by late May. By strengthening early-stage research and entrepreneurship, the program underlines the kingdom's commitment to building a domestic life sciences industry. Biotech and pharmaceutical developments. No major new drug approvals or product launches were reported in the Middle East during the week. Instead, regional leaders continue to lay groundwork for future growth. For example, Saudi Arabia's biotech accelerator, mentioned earlier, and similar plans in the Gulf signal a long-term push to expand R&D and manufacturing capacity. Industry analysts note that, over the past years, countries like Saudi Arabia have rapidly increased local pharmaceutical production. In this quiet period, health executives focused on such innovation programs and partnerships rather than on immediate market news. Public health challenges and disease outbreaks. The war in Gaza remained a central public health crisis. WHO's Eastern Mediterranean office highlighted a 2-part special issue of the Eastern Mediterranean Health Journal, released February-April 2025, examining Gaza's health fallout. These 38 papers document the conflict's toll, from trauma and infectious disease to chronic NCD care and malnutrition, with 9 studies focusing on children's health. WHO figures underscore the devastation. As of mid-March 2025, there had been 670 attacks on healthcare facilities in Gaza, killing 886 medical workers and disabling most hospitals and clinics. The special journal issue provides evidence to guide urgent policy and aid. These papers are freely available online. Aside from Gaza, other infectious diseases, like MERS, showed no new large-scale outbreaks in the region during this week. However, WHO continues to monitor endemic threats. For example, routine reports show sporadic MERS cases in Saudi Arabia, and the impacts of the conflict on public health. Wellness and health promotion. The Gulf region also saw expanded health promotion campaigns. In Oman on May 7, the Ministry of Health launched a nationwide drive for women's and children's health, under royal patronage. The campaign, a collaboration between MO, media, and NGOs, aims to raise awareness of preventive and therapeutic services, for example, prenatal care, immunizations, cancer screening, and to reduce maternal and child mortality. Local health officials noted strong gains in indicators. Maternal mortality and under 5 mortality have fallen sharply, but emphasized the need to widen access and community engagement as part of Omani Vision 2040. The World Health Organization's Eastern Mediterranean office marked World Hand Hygiene Day on May 5 with the theme, "It might be gloves. It's always hand hygiene." WHO stressed that rigorous hand washing is the simplest, most cost-effective way to prevent infections. In the EMR, an estimated 40% of healthcare facilities still lack basic hygiene infrastructure, and 71% lack proper waste management. The campaign urged governments and hospitals to implement WHO's 5 Moments hand hygiene guidelines and safe glove use. This aligns with WHO's 2024 to 2030 Global Action Plan, which makes hand hygiene a national priority indicator in all reference hospitals. Public events and training in the region on May 5 to 6 highlighted how better hygiene can protect patients and healthcare workers alike. This week's summary. During April 30 to May 7, Middle East health executives saw governments actively steering the sector's future. Authorities moved to strengthen health innovation, for example, Saudi's biotech accelerator, and preventive care, Iraq's vaping ban, while also responding to urgent public health threats. The Gaza conflict's devastating impact on healthcare was documented in detail by WHO and the EMHJ, underscoring needs for humanitarian aid and system rebuilding. At the same time, campaigns like Oman's maternal, child health drive and WHO's hand hygiene initiative highlight a regional emphasis on wellness and infection control. Overall, the week's developments point to a Middle East health landscape that is both forward-looking, investing in biotech and digital health, and mindful of persistent challenges, from conflict fallout to chronic disease prevention. Stakeholders should note these trends as health systems seek to balance innovation with resilience. Emerging programs will take months to pay off, even as day-to-day crises demand immediate attention. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.